Hi. So today's topic of discussion is called screening and cancer. So there is a word called screening. You all should understand what the word screening means. Screening is not prevention. Screening is one who has a cancer in him or her and you're trying to diagnose it in an early stage. That's called screening. Prevention is something like you are trying to stop getting cancer. So screening has got importance, or it has gained importance to a big extent these days because many of the cancers are not preventable. So diagnosing at the early stage is the only way which we can do for that. All cancers are not able to be diagnosed by screening. That is the main limitation of a screening. But some cancers, screening still helps, is what studies has shown. The most common screening method we use for one cancer is called the breast cancer. We use something called the mammogram or the X-ray mammogram. It's a simple procedure. It's an OP procedure where above 40 years or to some guidelines 45 years, once in 2 years, all women should undergo an X-ray mammogram for at least 65 years of age. So that helps to diagnose a breast cancer in early stage, and if diagnosed, even a correct treatment, you can almost cure almost all breast cancers. Other than breast cancer, the most common cancer which screening used is something called the cervical cancers, where we use something called the pap smear. A gynecology doctor or a nearby doctor can help you with this pap smear examination, and they draw your blood for something called HPV DNA assay or human papilloma virus DNA assay, and by this you can diagnose an early stage cervical cancers. Lung cancer screening has gained importance in last few years because majority of the lung cancers are diagnosed in advanced stages. So as per the guidelines, low-dose CT scan is one which is preferred. The person who has got more than 20 or 30 pack years of smoking history has to undergo low-dose CT scans once in 2 years is what the guidelines tell. But it's not yet commonly practiced in India because of the scarcity of the CT availability. Even our patients are on waiting list. So screening with a low-dose CT is not that feasible, but still it's still available. Other than that, colon cancer screening had gained momentum. Colon cancer screening is mainly done by a stool occult blood, where you send your stool sample for looking at the blood presence of any occult blood presence. There are something called flexible sigmoidoscopy or some invasive procedures which are done according to the 2-year or 5-year interval as per the family history in some selected group of patients. The message which I want to tell is basically screening is useful, but there are limitations with screening. You can't diagnose all patients in screening. All patients who are diagnosed in screening doesn't mean that they have to be in early stage. And the interval between 2 screenings, you can develop a cancer. But still, if diagnosed or if we are giving importance to screening, and if you diagnose screening based cancer, majority are seen in early stages and they are well curable. Thank you.